the summit and then of the speakers, and then I will chip in to take the conversation forward.
Sure.
Good morning, Mr. Jabiri. How are you?
Hi, good morning. I'm doing well. Hope all of you are also doing well and staying healthy.
Yes, all good. Thank you so much for joining in. I don't know if you've not switched on the video. Do you want to switch on your video and check?
Yes. Oh, yeah, wonderful. Yes. Yeah, this is much better. Hi, Varun. Good morning.
Hi, Seth. Good morning.
Okay, let me take a one quick minute again. How we're going to start. So my colleague Shivali will play a video sharp at 10 o'clock twice. It's a 1-minute video, and then my colleague Suresh will do the intro of the summit, why we are having this summit series. And then she will then do a quick introduction of each one of you. And then I will chip in and I will lead the discussion. So I'm going to be your host for next 1 hour then. And we will keep the discussion very simple, where we will start with the opening remarks, each one of you about how do you see the healthcare challenges and new opportunities in India. And after that, we will take maybe 2 or 3 quick rounds of question answers, but we'll keep it light, and we're essentially looking at the future, how technology will change, how data will be the key part of it, and how do you see as a thought leader the future shaping up for India in terms of good healthcare for everyone. And in between, if you feel you want to make a supplementary point, you want to add something, you just please feel free. So we keep it like a very healthy discussion for 40 minutes, 45 minutes, and then we'll break up for question answers from audiences. We expect folks joining from all across India, and our discussion will be also like a overall, like a national level, but we will also try to pick up a couple of things around Gujarat, because the summit is essentially on Gujarat. So we'll see what Gujarat is doing for the future, how the policies are happening, what could be good for future, for good health of Gujarat. So we'll cover those couple of questions maybe during the session, and then we will conclude hopefully by 11 o'clock, 11:10 or by 11:05 at sharp.
All right, I'm opening up the webinar for the participants to join in. And in another 1 minute, I shall roll the video.
And I would suggest you keep your video cameras off till Suresh introduces you one by one.
It's been more than a year since the COVID-19 outbreak. The pandemic has created an unprecedented global health crisis. It's time to look back on how our healthcare and life sciences coped with the uncertain times. It's also time to look at the future. It is time to recalibrate. It's time to act. Health of India is a series of high-profile power-packed virtual summits bringing together more than 50 speakers from across India. Throughout these summits, health ministers, policymakers, top CEOs, thought leaders, and technologists will initiate a new dialogue with focus on innovation, technology, and policymaking. Join the conversation as we respond to, recover from, and reimagine the future beyond the current global health crisis. Health of India, time to reimagine the future. It's been more than a year since the COVID-19 outbreak. The pandemic has created an unprecedented global health crisis. It's time to look back on how our healthcare and life sciences coped with the uncertain times. It's also time to look at the future. It is time to recalibrate. It's time to act. Health of India is a series of high-profile power-packed virtual summits bringing together more than 50 speakers from across India. Throughout these summits, health ministers, policymakers, top CEOs, thought leaders, and technologists will initiate a new dialogue with focus on innovation, technology, and policymaking. Join the conversation as we respond to, recover from, and reimagine the future beyond the current global health crisis. Health of India, time to reimagine the future.
Thank you so much, everyone, and a very, very good morning to all our participants, all our speakers, and our partners present in here today. It's Health of India, time to reimagine the future, and the time to act is now. Right now is what is our tagline is. With that, allow me a moment to start my screen share. All right, so thank you so much, everyone, and a warm welcome to all of you. Thank you so much for joining in. We know it's not easy, all the online webinars and the conferences, and like all other webinars during these strange and COVID times, this one too is going to be virtual. We thought that in the last summits that maybe the next one is going to be an offline one, but sadly the COVID situation still doesn't permit us to do that. All of us have witnessed the worst crisis of the century, a crisis which has taken away lives and livelihood, just taken away lives of our really near and dear ones. I think in the last couple of years, it's been really, really difficult for all of us. It's 2 years into the pandemic now, and it's now time to take stock of how healthcare and life sciences have managed to cope up with such uncertain and stressful times. And we've also witnessed a lot of gaps and vulnerabilities during the COVID times. The pandemic has definitely created an unprecedented situation and a very uncertain time in the global health. But at the same time, I would say that it has also created new opportunities for future partnership towards robust solutions which need to be implemented in healthcare. And when we say it's time to reimagine the future and the time to act is now, it's right now. With that, I would want to take a moment to introduce myself. My name is Surabhi Pandit Nangia, and I'm the Director, Outreach and Partnership with Data Leads. On behalf of Team Data Leads, Health Analytics Asia, and our partners, Birlasoft today, I extend a warm welcome to all our esteemed speakers, our guests for the Health of India Summit, specifically for Gujarat today. What is the objective of this series and why are we here? The Health of India series presented by Birlasoft is convened by Health Analytics Asia and hosted by Data Leads as part of a Pan-Asia Health Dialogue initiative to build a committed platform for strategic collaborations in the ever-evolving areas of health and life sciences. These series, by way of all the series and the talks that we've been doing, and today when we are in Gujarat, this will feature health ministers, policymakers, CEOs, thought leaders, technologists, and journalists as part of participants in high level and speakers in high level deliberations on health with focus on specifically innovation, which is very important, technology and policy making. The spread over 8 states, the series will highlight pivotal perspectives of the states that drive India forward, promising to shape countries' healthcare and life sciences ecosystem in the years to come, which is very, very important. Before we start, I would want to take a moment to introduce Data Leads very briefly. Data Leads is a digital media and an information company which aims to help people understand and engage with the world around them. We work with the world's leading media and tech giants and tech companies and regularly partner with them in various collaborative initiatives, which include our work spectrum basically includes capacity building initiatives, fact checking, media research, data-driven content, data-driven initiatives, and events with a focus on building collaboration in public health. We are proud partners. We are very, very proud partners of Google News Initiative, Internews, WHO. In fact, the Google News Initiative, we launched a pioneering information literacy program and a fact-checking initiatives in India, which has benefited so many newsrooms and organizations and universities across India in over 15 plus languages, which is still running. Data Lead's flagship project is Health Analytics Asia, which is Asia's first data and health information platform, building collaboration between journalists, doctors, and technologists. This is where people ask us, what are journalists and doctors and technologists doing together? So this series is also one of the initiatives where we get journalists and doctors and technologists and the think tanks together. Our approach to build collaboration with doctors is globally recognized as a very, very unique initiative in healthcare reporting. And in fact, we're also the proud recipients of the Membership Puzzle Project by the New York University. In the past, we've awarded by the prestigious British Medical Journal Award, which is very, very, very prestigious and a matter of honor for us. So with that, I think I would end my introductions and take you briefly to the agenda for today. Keeping in consideration the extreme fatigue and the people that are witnessing because of online sessions and webinars, they're all tired every morning doing a Zoom or a Google Meet. We've tried to keep this agenda as crisp, as short, and as focused as possible. We start with a panel discussion, which is reimagining the future of health. And we will then move on to the flash talk sessions on innovation and collaboration. With that, I want to set up the stage for our first session, which is the plenary session on reimagining the future of health. Our goal here is to bring different set of perspectives, different minds, different experts who will share their ideas and vision about the challenges and the new opportunities, the challenges that we've been facing that are there still, and the opportunities that lie ahead in healthcare. The idea behind is to drive collaboration and partnerships to come together to make a dent in this huge challenge that we are facing right now. We have 4 most eminent speakers for this session today, and a brief line of introduction. It's a matter of honor to have all our speakers present in today. Thank you so much for joining in. To begin with, Dr. Kranti Suresh Borah. She's the additional professor at IIPH Gandhinagar. She's an obstetrician who completed her MPH from Johns Hopkins Bloomberg School of Public Health, USA, and PhD from University of Maryland College Park. She managed large projects and has contributed in renowned journals such as PLOS ONE, WHO Bulletin, JHPN, among others. Thank you so much, Dr. Kranti, for taking out time and being here for this very, very important discussion on reimagining the future of healthcare. Our next speaker, our next most renowned speaker is Dr. Naveen Thakur, a well-known pediatrician of Gandhidham, Gujarat, and the director of Deep Children Hospital and Research Center. He's also currently a member of COVID-19 vaccine immunization task force member with the Gujarat government, pneumococcal expert group of Ministry of Health and Family Welfare, Government of India, and Indian expert advisory group on measles and rubella. It is such a pleasure and honor to have you here with us, Dr. Thakur. Our next speaker is Sangram Kadam. Mr. Kadam is the Vice President and Business Leader at Birlasoft, a seasoned industry leader with over 20 years of experience in strategic business development and go-to-market portfolios across the APAC and the META regions. In his illustrious career, Mr. Kadam has donned multiple hats and is known for his personnel management, new business acquisition, and partnership development skills. Thank you so much, Mr. Kadam, for taking out time today and joining us for the Health of India series. Our next speaker today is Varun Jabiri, who is the former OSD National Health Authority, Government of India. For National Health Authority, Mr. Jabiri led the healthcare innovation strategy, health infrastructure strengthening through the PMJ financing, and provided overall policy and strategy support to the CEO. He is currently working as an advisor to the multiple early stage startups for supporting them in gauging market fit and chalking out the growth strategy. Thank you so much, Mr. Jabiri, and everybody else for joining us on this very, very important discussion. I would now invite our founder CEO, Syed Nazaka, to take this discussion forward. Thank you so much, everyone, and over to you.
Hi, Subi, thank you so much for doing the introduction and letting this, the very special session to start. I'm really delighted and honored of hosting this session. I remember early this year when we were dealing with the devastating second wave of COVID, and we were looking at how, as a media company, we should be addressing this issue. What is our contribution, at least to help people to understand what's happening all around us? So the team of data leads, in consulting with a lot of good friends around, with a lot of doctors on board as well, we thought every crisis is an opportunity to build things, actually. We thought, we know there are serious problems right now. We are in a very difficult situation globally, everyone. Like 5 million deaths by a disease so far. It's devastating all across the world. We have in India 500,000 people who died because of it. So I think the thought leadership in the country, I think everyone came forward to see what best we can do to mitigate this situation. And at the same time, I think everyone also started chipping in to look at next 1 or 2, 3 years in the immediate future, but then also have a long-term policies now, which can help us to prevent situations like this in the future, and also improve the healthcare for everyone, to make it affordable, accessible in different states. So this summit was a part of that discussion, that we thought no matter how big the problems are, we should stay focused, optimistic about the future, and we should work towards the future. I think that was our understanding behind it, because we also, as a team, are very clear on the fact that we need to also invest, even if the times are bad. The good ideas have to come from the bad situations. So I think that if you look back at the history, we see every big thing has happened after the big challenge or a crisis. There were people who came forward, they came with novel solutions and all. So health is something, gladly now, because of the COVID, everybody is talking about. In journalism, it was not a page one story ever, because this was seen not so significant. The discussion will be all about politics, all about businesses, other things. The health was not a priority. But today, everyone in the world is talking about health. So I think this will help us to put focus back on it, on future. And then we will also be able to identify the best ideas moving forward. And we will encourage different stakeholders, including the private industry partners and the states, to invest more into healthcare so that everybody has a good health in the country. So I think I'm very glad and honored to have very distinguished panel on board. The format we will follow here, I will go to each speaker briefly for opening remarks, and then we will do a quick 1 or 2 round of discussions. And then at the end of it, we will have a question answer from the audience. We're live on YouTube as well. So we expect some questions from the YouTube channel who are joining us out there. And my colleagues will help me to put those questions together at the end of it. So if I start, Dr. Kranti, with you. So we are still in a very uncertain situation, given the COVID is still there. There's a fear of one more variant spreading widely. We are still dealing with the situation. We don't know how it will unfold next year. It started, it has been almost now like 2 complete years in the middle of whole crisis. How do you see the current situation first, if you do it briefly? And what do you think was the key learning for all of us from the COVID-19?
Thank you so much. Thank you, Data Leads, for inviting me for this prestigious summit. Yeah, we have been in a situation which is once in lifetime sort of thing. And it has been devastating, as you said, but also great learning experience. I saw your other summits, and people have been talking about many things. But one thing which happened in Gujarat, and I'm sure happened in other states also, is this exposed our limited laboratory capacity at district level. Big towns, big cities had. So in Gujarat, we saw in second wave, sometimes it took 2 to 3 days to get results of RT-PCR because there was limited laboratory capacity. So this has been a great learning, and at IIPHG, we have been pushing government of Gujarat to improve laboratory capacity for not just COVID testing, but any viral diagnostics that should be done at district and sub-district level. And as you said, involvement of private sector would be really important in this, because public sector by itself cannot do this. Fortunately, in Gujarat, in contrast to many other states, we have non-profit private sector, a very strong non-profit private sector at district and sub-district level. So involving them to improve laboratory capacity to not just diagnose viral diseases that are known, but also if any new viral disease comes, to quickly develop testing capacity for that. That's, I think, a very important learning from this pandemic that has come across in Gujarat. Thank you.
Yeah, so that's really critical. I think that's across the states now. Everybody realizes that healthcare has to reach people at the doorstep. So access is critical. And you mentioned districts, authorities taking the initiative on bringing the diagnostics closer to people. I think that's really critical, and that's also the future. Like we need to be there in small towns and in all the districts across the country. Dr. Naveen, how do you see what has been our great learning from COVID-19?
Thank you so much for invitation. And yeah, so first thing is that only thing certain as of now is uncertainty. We don't know how long this uncertainty will prevail, and we will talk about this more, what it brings with this. So for see, this COVID pandemic has very clearly shown the fault line in our health infrastructure system, and the disparity, equity, that how the marginalized population suffers more in this pandemic. But as everyone is saying, there are good learnings also, and what can we learn, and what can we, how we can build better. The first thing, being in Gujarat, and as we are seeing the urban, now the trend in the urbanization, and we have to definitely, India has a very well Indian, National Rural Health Mission, and then we also launched National Urban Mission, and now it's a National Health Mission. But still, a lot of needs to be done for urban health. And being in Gujarat, where it's a very most of the population lives in urban area, and we need to do definitely ramping up the health infrastructure, and capacity building of health workforce. We saw what happened during the second wave, and before that, the indiscriminate use of say drugs and everything. So that has to be really a very systematic with quality improvement, capacity building of health workforce in a, to do a quality way. As I said, in urban health, and then also we learn a lot about digital. We utilize digital healthcare technologies very well, and that has to be leveraged for the future. Uh,
Right.
that's very important, that this is the best opportunity where we can really now, we know now, as a pediatrician, I know how I do now teleconsultation and all that. Before that, I was prepared, but the others people were not prepared. So we have to do everything. It's not one or other thing. As madam said, laboratory capacity, genomic surveillance, everything has to go together, and definitely we can do that with the vaccination. We have done that, so why not? Gujarat is always a leader in everything, so we can definitely do that.
Thank you,
I think
Dr. Naveen. I will certainly come back to you on, the digital health initiatives, maybe in the second phase. If we go to Sangram, to you, you're a technologist. You're leading a technology company which also runs hospitals. So you have the advantage of insight how technology works, but also how hospitals and healthcare works. How do you see what has been the key learning for a company like Birlasoft in the last, like 2 years, dealing with the COVID situation and delivering the healthcare solutions to people?
Thank you so much, Said. First of all, I wanted to thank all my health service providers, healthcare workers, including doctors and nurses, for the outstanding work they have done for last 2 years. So on behalf of, I think, all of us, we should thank Dr. Thakur and everybody who has really helped us to maybe sustain and come out of this pandemic. Of course, it's still not over, but once again, thank you so much. Coming back to your question on the learning, I think being a technology company, and as you rightly mentioned, as a group, we have our own hospitals as well. And we have first-hand information what's happening in the overall healthcare sector. Couple of learnings, and I think Dr. Thakur touched base on some of those points. In the technology adoption, if you see, always healthcare sector has been at the forefront. Along with the banking sector, healthcare was adopting some of those areas. But I think what these last 2 years has really helped them to understand the importance of technology. Number one, a lot of examples, both Dr. Kranti and Dr. Thakur gave. The backbone was technology. Second, he spoke about digital. And I think that is the biggest area I have seen, that across the value chain, people understood, whether it is the patient like me or the expert doctor or a healthcare provider or even the government. I think everybody realized the importance of digital and digital transformation. It was very difficult for us earlier to go to doctor and actually convince them the importance of digital. But now I think it's the other way. Everybody is coming behind us that this is what they want to do, digital. Everybody's definition of digital is different. So that's the second. Third, I think these some of the challenges what we have been faced as India. And I think I really put it, healthcare is the only sector we have seen clearly division between India and Bharat. So whether it is the metros like Ahmedabad, Surat or Pune, Delhi, or the rural areas, I think we can see there is a contrast when the healthcare overall scenario. And that is same absolutely for the technology and digital as well. So what we generally call digital divide, we could easily make it out that is last 2 years, there has been a clear-cut digital divide between the India and Bharat. So these are some of the learnings. But at the same time, as a technology company, I feel we got a lot of opportunity because naturally we need to have the testing done on time or at the earliest. We need to make sure the drugs are developed. We need to make sure the vaccines are developed. So all those were actually with the backbone of a technology and a digital. So with these, I think brought a lot of opportunities for companies like us. And that is where if you see overall technology company really have thrived. There are a lot of innovation has happened. People are coming with the problem or a crisis, always give us an opportunity to do something different. Work with policy makers, work with the doctors, work with the patients and understand what is the better we can do. So overall, whatever we talk about, whether it is patient experience or healthcare experience, I think there has been a lot of changes. So at a nutshell, if I had to put in, I will say, I think faster adoption of technology and the emergence of digital in overall healthcare ecosystem, not only the high-end hospital, I think has been emerged. These are the couple of learnings for companies like us.
Right. No, there has been a fundamental shift how people see technology, the role of technologies in healthcare. That takes me to Varun. Varun has been a part of National Health Authority. He has been advising a lot of health startups how to innovate, how to look at technology. Varun, how do you see what has been our key learning from COVID in terms of course, providing better solutions, healthcare solutions?
Thank you, Mr. Syed, and thank you, data leads, for inviting me here. Always great to share some of the learnings, that I personally witnessed. So when, there was a first wave, I was at the National Health Authority. I was working as USD. So, we were pretty much in the thick of things. And just to give a context, the National Health Authority, it manages the Ayushman Bharat program, which is, the world's largest healthcare financing program, and the recently announced Ayushman Bharat digital mission, which Mr. Sangram was also mentioning about the whole technology backbone. So really, this were the two projects that we were looking at, and when the first wave really struck, of course, none of us had that type of institutional knowledge of how the pandemic is evolving. So a lot of it, that was happening. Even if you look at, the guidelines, if you look at, the type of central to state communication was happening based on a very proactive approach. There was a lot of coordination that was really happening with the central government, the state governments, whether it's with regard to, how to really, identify the, the risky zone, the vulnerable zones, or, how to even develop technology solutions like Arogya Setu. So a lot of it, was really starting to happen, like, the type of understanding that we have of the bureaucracy. I think it was 180-degree opposite to the way it was really working. I think in terms of the learnings, quite a few learnings. The first one that I feel is the importance of defragmenting the fragmented health system, especially between the public sector and the private sector. The reason why I say that is that, whenever we talk about the health systems, we have, a very strict demarcation between the public and the private health system. What has that really led to is that it has cut out the information flow between both the systems. It has, really put those systems into silos. And I think what COVID showed us that there is an important part that is, that is very essential, which is the synergy between the private sector and the public sector, especially in strengthening the health system. If I have to give one example, the example can be the manufacturing of PPEs. Like when the COVID wave really struck, we did not have PPEs. We were actually importing. But within 2 months, because of the collaboration that we really did with the private sector, within 2 months, we were having a capacity that we were exporting the PPEs to the world. Same with the, nasal swabs, which was required for the testing, which even, Dr. Kranti mentioned. So the idea is that how, rather than seeing them as two different sort of entities, which functions very differently, how can we really start bringing them together? What are those different avenues that we are really nurturing? The second one that I want to, probably just build upon to what Dr. Naveen and even Mr. Sangram said is the whole health information and data sort of, synergy or data information symmetry, which is really required. So what really happens is that, I go to one hospital, the hospital has the data, but when I go to another provider, there is no particular, data exchange that happens. So, patient history, patient's requirement, a lot of it is actually, worked in silos. So if you look at, the Ayushman Bharat digital mission, that is exactly what it tries to do, that, provide that particular interconnected backbone, gives that hospital management system, personal health card, so that, the entire journey can be tracked and can be stored in a way that is, where the consent is only with the user, but there is a proper information exchange and information symmetry that can be really built. Such type of things are essential to the pandemic and the pandemic management, because what really happens from a policymaker is that, because of the unavailability of the dynamic data, it is very difficult to understand in what geographies what is really happening. Thankfully, we had Ayushman Bharat, which is backed by a digital system. So I will tell you a very interesting thing. In Ayushman Bharat, every day we used to measure the geographical spot of cases which were associated with the symptoms of COVID-19, such as where is the sort of an increase that is happening in reporting of acute pneumonia, how many people are getting hospitalized in that. So when we used to measure those particular geographies, we used to understand that these are the areas which require some sort of a further clarification. And the
Right.
final thing that I feel is this expanding schemes such as Ayushman Bharat, for a larger number of beneficiaries. I think that can be important to protect the vulnerable, especially in times of pandemic like this, that how to cover their particular treatment. So, just building on the point of the healthcare strengthening, I feel it is important to do that along with the expansions of schemes like Ayushman Bharat. So I feel that, these are some of the learnings that I personally witnessed, which will be helpful for not only for Gujarat, but for the entire country.
Right. No, thank you so much. Really, I think very important points, and we will certainly come back on a couple of these points, particularly about the insurance as well, how we can take care of the people who don't afford a lot of healthcare. Often in most of debates in our country, we often tend to neglect 50% of the population, and that happens because somehow down the line, men are important than women in our own understandings. And when we look at the official data as well, we see majority of men actually die in hospitals. Majority of women in India die at home because somehow, family, whatever, we feel like if a male person is sick, we immediately rush him to hospital. If a female person is sick, we try to give some medicine at home. She'll be okay by next day. So that takes me to my question to Dr. Kranti. How do you look at the health of women in India? And what do you think are the challenges for us to provide better reproductive health systems or women healthcare in India?
Thank you so much for that question. And that has been an area which has been very close to my heart for a very long time. India, like we say, it's in a demographic transition for non-communicable and communicable diseases. Similarly, India is in transition for reproductive health and women's health. So on one hand, we have still mothers dying because of lack of blood, because of anemia, because of basic health care that they should be getting, antenatal care, identification of high-risk pregnancies and management of high-risk pregnancy well. And on the other hand, we have now almost double the number of reproductive age women dying because of cervical cancer, breast cancer. We also have women now dying because of cardiac diseases. So we are in a transition and the health system needs to respond to that. So we still need to take care of maternal health, where we need to ensure that we provide blood, we provide emergency obstetric care, and at the same time we need to ensure that there is screening of reproductive health cancers such as cervical cancer, breast cancer, and cardiac diseases. The last NFHS showed that less than 2% of women who were eligible had ever cervical cancer screening in their life, which is a dismal number, given that in August 2020, August 21, WHO declared elimination of cervical cancer. Elimination, like any infectious disease, polio and others, elimination of cervical cancer, UK and Australia will achieve in next 2, 3, 4 years. And we are still at very low, given the kind of digital and other technology that we have. And I would like to talk more about that maybe when we come to the recommendation part of it, how digital technology can help in, follow up of this women. But I think the health systems have to be responsive to ensure that they take care of those two extremes for women's health.
Right, Dr. Naveen, if I come back to you about health of children in India, you spend your whole career essentially in this space. What do you think are the best global practices, or even within the country, which could be really amplified and enhanced, and to improve the child healthcare in India? What do you think are our key challenges in the next 10 years, improving children healthcare?
So thanks for that question. See, there are two things. One, there are issues of survival, and then there are issues of say development. So India, we have both. We are still, our infant mortality has come down, but still we have neonatal mortality, which is high. And again, there there is how we can invest more in, because urban newborns, there the mortality is even mortality is higher than the say rural newborn, poor urban newborn. So we have to definitely invest. We know what works. We definitely know what works in newborn. Our other problems are diarrhea, pneumonia, and enhancing the coverage of vaccine.
And Dr. Naveen, we're losing you in between.
Maybe
We can't hear.
I can stop my video.
This is better. This is better. No, this is better. You continue, Dr. Naveen. Yes, please.
Yeah. So what I'm saying, we know what works, and we need to do more, and do the scale up of say our interventions what are proven. So that's one thing. And like we had when we talked about the third wave, we did a lot of preparations for the children, because people said the children will be affected more. But that was a in response to the third wave. But we have to definitely, and that has brought to our knowledge that how much we need to do more for the child health in India. So that's one thing about the giving care to the children when they are sick. But we also need to do more for they have the best potential to grow in their life. So I think a lot of work needs to be done, and it should not be ad hoc like for third wave or for anything. We need to do on everything where there are issues of survival. And again, we cannot separate mother and the child. It has to be a family approach. And also, if we talk about immunization, it should be across the life course, not only. And we have opportunity now with this COVID vaccination, where we talk first time about adult immunization. So there are opportunities, and we have to have a definite plan. And definitely for survival now, there is more focus on newborn, and newborn has not got attention which it deserves so far. So I think I will stop here and maybe.
Okay. Thank you so much. And Sangram, like you're leading a tech company, and what do you think? Like particularly, if you give one or two examples, how really we hear too much about technology making change, data making huge change, but there are a couple of incidents maybe you want to share where you can give us a sense of how really it's happening on the ground. How is technology helping healthcare in terms of its delivery or in terms of its diagnostics? And if you also identify, if I add that question, if you also identify what are the one or two challenges in terms of better use of technology in healthcare, given the regulations in India and all.
Sure. I'm first of all happy actually even the doctors and the policymakers also talking about technology. And I think Varun spoke a lot about how technology has really helpful or a backbone for Ayushman Bharat. So taking some of the example, I think all of us are of the opinion that if you really wanted to cover the overall India as a part of universal health coverage, so that even the last person on the ground is covered under the healthcare, I think it is imperative that technology and healthcare need to talk to each other very, very seamlessly. Number one. Number two, I think the good news is there is a change. Technology is all pervasive. Technology is helping us to address India's unique challenges in terms of whether it is, you spoke about accessibility, whether it is affordability, or whether it is the quality of healthcare as well. So though at a very nascent stage, the rate of adoption is, I will say, rather fast. At least last 2 years, the rate has really accelerated. And given the size of the overall healthcare sector, I feel the scale as well as the impact will be very, very large. Couple of examples, if I really have to call it out, I think we can start with take example, some of the technologies I wanted to again give. IoT-based wearables. Now, those patients who are at home, it was very, very difficult for them to really monitor their parameters. There are a lot of technology companies who came up with a lot of wearable devices. I think all of us are aware about the innovation what MyLabs did. They actually kind of innovated the first COVID testing kit for the country. It was the indigenously developed. Now, it was all based on the technology. If I have to give you our example, we work with one of the largest pathology lab services chain in the country. As you know, the earlier, somebody has to go to the lab. There were some home samples collection and all that. But what has happened with the technology, I think all those things became very, very accessible. Somebody who does not have even a basic education, with the use of technology, he can use the use of mobile. He can go to the homes and collect the samples. Even the sampling of those samples was done online. Reports were available. And I think the term as a big data, all of us may have heard, or a data science, actually was originated from healthcare, because a lot of those clinical trials and the drug development, what pharma companies used to do, or the vaccine company, I think that data has been analyzed and utilized. So even there also technology has a play. In our own hospitals, I think Varun spoke about the health hospital information system, or HIS. I think initially the adoption was not to the overall functionality, but today, right from the patient monitoring to the ICU management to the pharma management or to the pharmacy management, I think almost the entire spectrum of the overall healthcare has been covered. Second, I think during COVID, the biggest obstacle was the supply chain. People were struggling to get the remdesivir. Again, the supply chain technology really helped the government as well as the district administration to really track and trace where are those medicines, which hospital medicine require. And I think Varun mentioned about the geographical spread or the areas where the emergence was more, so that the entire medicine was diverted into that particular district or the area. I think that all was possible because of the track and trace and the technology behind it, which we at a broader level call that as a supply chain. We heard a lot about the artificial intelligence. We heard a lot about the blockchain, but I think this technology also we have seen being adopted during these 2 years by the different stakeholders in the supply chain. So I don't know how many have heard about the EMR and EHRs. I think those really can be really populated and maintained by the blockchain. This is nothing but actually the different chains we are bringing together. So we have done one project with one of the, again, a healthcare service provider using blockchain as a technology to maintain their medical records. And we use the latest blockchain technology. And we were surprised that even the doctor and the administrator, they're talking about this technology. So overall, I think whatever digital technologies we all are talking, we have actually seen the practical applicability and uses of those technology, and not the traditional, I think the ERP and all or the systems,
right.
All of us talk. But these are some of the advanced technologies what we have seen. So overall, I think if I had to put, say, it's the overall experience, whether it is patient, whether it is doctors, or whether it is government. I think we really work on the overall experience economy to the stakeholders.
Yeah, let me take that to actually Varun. Varun has been working with a lot of startups actually. Varun, how has been your experience with these young startups from Hyderabad, Pune, Bangalore, Ahmedabad? How are they using technology? Are there really things coming up which are new, which could really help us to make healthcare accessible to people at affordable rates and all?
Thank you, Mr. Sayers, for that question. Well, very simple answer, absolutely. Where I am seeing a lot of innovation happen is healthcare, especially health tech part of it. Of course, there are other models in the healthcare, like, the new innovative service delivery mechanism, something that, Pristine Care or NephroPlus guys are doing. But at the same time, there's a lot of innovation happening in the overall health tech domain, right from, screening of diseases to measuring, vitals, to really, helping in the swifter management of the data flow, integrating travel and health, to give a very safe travel sort of an experience. So, essentially every particular step of the value chain, there are a lot of startups that are really working. Let me just, compare and contrast the pre-COVID and the post-COVID era for the healthcare startups. In the pre-COVID, the post-COVID, the awareness for health and wellness that is strongly augmented. People are now more aware. They want to, take deeper care of their health and wellness. So that is a big sort of, push that is coming. The second thing, which I think is probably one of the biggest disruption, is the government coming up with the construct of the digital public health goods, which is, the Ayushman Bharat digital mission. So what the government really did in 2016 with the fintech, by introducing the UPI, on which, on top of which the Google Pay and the Paytm sit, with the Ayushman Bharat Digital Mission, it's a similar construct for the healthcare system that, we are giving you the fundamental digital public health good. Why don't startups come and build on top of that? So I think, with this public digital health infrastructure coming, a lot of startups have started building end citizen services. So they are getting the APIs, from the Ayushman Bharat Digital Mission, and they are building end citizen services. So I think that itself is a big sort of a disruptor. The third thing that I'm really seeing is that now there are more and more avenues which are available for clinical validation and commercial validation in terms of funding, as well as acceptance from the doctors and the clinicians. They are understanding that how technology really played a critical role in management of pandemic, and how it is also making the healthcare system more accessible, affordable, and delivering a better quality of care. So the whole gestation.
When you talk to startups in healthcare space, do you see the kind of a concern from a lot of startups that the atmosphere, the business atmosphere, is not so incentivized in their favor, or are there policies happening which are making it easy for tech companies to work in the healthcare industry?
I would say that, now I'm able to see some sort of a change, because, something that I always say is that if you're doing a startup in healthcare, it is very different from, some other sector, because the gestation period is too long. And there is a huge dependency on external stakeholders like clinician, government regulators, hospital administrators, because you don't need to only design the product, but you need to show that the product is working as well as it is safe to use. So there's a lot of external dependency. And what also it leads to is that, if you have a VC who is funding it, he will compare the growth rates. So a VC will say, hey, the fintech is, growing 30%, 40% month by month. You are growing 2% month by month. So you also need that type of sensitization in the funders, that the healthcare sector as such is a different one. So of course, initially there was a lot of inertia, and that's why you see, if you look at the unicorns right now, which have been really made, you will see, very few in the healthcare space. But, my understanding is that the next decade that is coming, right from 2022, that belongs to health tech, because now the conditions have become very conducive, whether it's with regard to funding, whether it's with regard to regulatory approval. And of course, policies are evolving, but more and most importantly, there is a lot of awareness and sensitization that has built. So the adoption inertia, which was there, that, adopting a new technology for a clinician, it's a risky task. But now
if I ask Sangram here, he's in tech there. Sangram, what are the incentives, like a tech company like you are of course not, you're a major player there. But what are the incentives the healthcare tech companies looking from the government?
And I think Varun touched on a few of those aspects as well. We have incubated a few of the startups as well as an organization, as a group. And you're absolutely right, Varun. Our understanding was initially fintech and the manufacturing tech. Those startups were much easier because it was more technology driven. Unfortunately, in the health tech, what has happened, a lot of regulatory and compliance driven procedures were in place. So unless I have doctors as my advisor, unless I have a healthcare professional as my advisor, it was very difficult to really come up with a purely technical kind of a solution. So one, actually, it took a lot of time for all of us to understand the dependency on the external factors, number one. Number two, like the government has come up with SOPs for the PLI and some other startup initiatives. My recommendation to Varun, and he can convey to the authorities, we should really look at healthcare, maybe incentives, similar to PLI incentives for the semiconductors. Can you look at healthcare incentives for the startups? Number one. Number two, can you have some relaxations on the norm? Because as you rightly mentioned, the lead time is so high. So sometimes the startup starts, and I know at least where we were closely associated, out of 10, 5 are left in between because they said it's very, very difficult for them to really sustain. So can government come up with some schemes which will help them to at least reach to a certain level? Beyond that, they can take a call. And third, I think the overall investment community, they, thanks to COVID, I think that's the only reason I thank COVID, they realize that the importance of the technology and the importance of investing. So we are seeing more and more VC as well as funding organization coming forward, and they're trying to invest. In fact, the companies like us, because even though we are a technology company, I think all of us cannot do everything. So we are also looking for similar sweet spots where we can work with those and actually we can augment our services. So we can also partner with a few, and we are also giving them some incentives. So a lot of programs actually government is running, but of course a lot to do both at a state level as well at federal level.
One of the major challenges, of course, technology, data, money, the government's willingness, the private sector's willingness in the healthcare, they're all critical components. But one of the key challenges of healthcare also has been awareness, public awareness. And in a country like ours, we really struggle with helping people, for example, hey, this is a good vaccine, you need to take it, but they don't take it because of a lot of rumors, because of a lot of unscientific beliefs, or maybe because of a lot of other issues. And I will come back to you, Dr. Naveen. You have been really working globally on vaccine hesitancy. Vaccines save millions of people around the world, but somehow we still see there is a vaccine hesitancy. Even during the COVID phase, we saw people actually little reluctant going for vaccination, maybe perhaps for a couple of reasons. But I just want to understand, Dr. Naveen, from you, how do you see, what fuels vaccine hesitancy in India? Are there any particular reasons for it?
So first thing we should understand, there are no organized anti-vaxxers in India, anti-vax groups in India. Vaccine hesitancy is expected. And we people have genuine concern. We should not focus on that extreme vocal vaccine denier, but we should focus on people who are sitting on the fence, or what we call hesitant, because of different regions. And they have genuine concern. And mostly with COVID vaccine, what are the main concern? Only two, and which is still valid today: efficacy and safety. From beginning to now, these are the two main concerns. And why? When you have uncertainty, when you have ever-changing guidelines, new trials now announced directly by companies in press conferences rather than the peer-reviewed journal. So all these, when there is uncertainty, lack of trusted sources, then you get people get confused. They look for answer, and then everyone is expert and speaking on TV nowadays. And then you have WhatsApp University, where everyone is trying to forward it far. So these are some of the factors. And what we need to do, the first thing we need to do, we should have honest and transparent communication. And it should come from the trusted sources. If you don't have, if you just declare, approve a vaccine, and you don't put data in the public domain, India is very democratic and very highly scientific community. They will question. So you have to be very clear that it is a transparent communication with evidence. Otherwise, it will be questioned. Then it is coming from the trusted voices, and we know who are the trusted voices, scientists, and that something we did good, that we put the scientists in front of that. Then what else we can do? Another thing is digital literacy, and your data leads have done an excellent job in that. But we need to do more. Sensitizing media about science communication. Science was never discussed in television. It was always discussed within rooms where scientists will discuss, because it's not easy to understand the science communication. So we need to better sensitize media about the science communication. Follow the best practices. Like, the simple thing I say, if you stop forwarding the WhatsApp message without checking, fact checking, without, and what they write, is this true? Why you are writing, is this true? Why you want to be the first in, because of different reasons. So we need to do the best practice, follow the best practices, digital literacy, and so many other things. But the most important is honest and transparent communication. Thank you.
Dr. Kranti, if on a communication and awareness, thing, how do you see quickly of that role in public health?
Thank you. Before I go to that, I just wanted to make one point about the health innovations. Somebody who's a clinician and a public health professional, I've worked with innovations. One thing which is different in healthcare innovation is, unlike any other machine, which you can test for 4 or 5 conditions and you are done. Human body is variable. and you need to test your wearable or whatever other innovation you have in extreme conditions, and that validation becomes very expensive. Unfortunately, we don't have public health laboratory which is ready for any innovators to come and test out their devices or whatever innovation they have safely. So we need to invest in something like that for India to become a pioneer or a leader in healthcare innovations. And this is something in addition to digitalization and every other technology that you had. I went off.
No problem. This is
So-
the great point. If you want to add one quick point on awareness, how important is that?
Yeah, awareness is important. And I think we have a huge healthcare force which works on vaccination, right from ANM, ASHA to everyone, that has been used for COVID. But I think to improve awareness, we need to make them better skilled at communication, to ensure that you have somebody from the same village speaking in the same language and giving uniform message across India, which has been given by either state or district or taluka, so that people have similar message and they know how to communicate it well to the last citizen that is there. So I think that's really important thing, and digital technology can help in that.
Right. We have a couple of questions. So what we're going to do is that we will have a couple of questions from audiences. Then I will come back to you for a final thoughts very briefly then. So there's a question for Varun actually. Do you see the COVID-induced synergy between private and public sector likely to last beyond COVID-19 situation? Because we saw a lot of collaboration happening in the last 1 or 2 years. Will that last after the COVID is over?
Yeah. Thank you for that question. I absolutely think that COVID is an inflection point, not only in terms of the way we look at the healthcare, but even the way the healthcare is going to be structured beyond COVID. One interesting example that I can give is the whole construct of the public-private partnerships, which has been launched at a national level, which is backed by a viability gap funding that the government has launched. So the idea is that how can the some of the public utilities or some of the public hospitals engage some of the private providers? At the same time, if there's a private provider who wants to establish a new hospital, how can government get involved? So I think the whole idea and the whole construct of the public-private engagement is here to stay, because you really need to start clubbing the resources whatever available. If government is a good payer and a good regulator, and a private sector is someone who can operate better on a day-to-day basis, you have a good synergy there. Because ultimately, rather than fragmenting the systems, it is important that we come together and we play to the strengths, because I think that is where we really need to work hard. Even when it is with regard to the public doctors and the private doctors, can we have more resource sharing? Can we have more information sharing? So I feel that this idea and this the whole strategy is something which has taken roots in COVID, and it is bound to stay and it is bound to grow. What is going to be interesting is at what pace. I personally remain optimistic, but I think we'll wait for that to happen.
Dr. Kranti, there's a question. What are the key skills that MBBS doctors should have who are passing in the next couple of years? Beyond their clinical practices and knowledge, what are the key other skills they need to have?
I think, and I look back to my years as MBBS student and resident, communication, including empathy for the patient, not looking at patient as a body. And that was taught to us to be protective for us so that we are not emotionally drained out. But that is one thing I think we need to teach our MBBS doctors and even residents who are doing post-graduation. And the other thing is research skills. Research is an area which has been left to people who are thought to be scientists and not clinicians. And clinicians, although it's changing now, but I think that is something which needs to be part of MBBS curriculum and need to be taught the way it is taught in some developed world.
Right. Dr.
Can
Naveen,
I add?
Yes, please. Yes, please. Yes, please.
So, this is part of our IPA Vaccine Plus project. The first thing is interpersonal communication. Doctors are very poor in interpersonal communication, and as we teach, it is not important what do you say, it is important how do you say. And that's very, very important. So interpersonal communication, social media skills, using social media for advocacy, healthcare needs, everything, and, dealing with media, because anything happens, we will be brought, by government that you face the media, but we are not trained. We are not trained in media skills. So these are the basic skills, required for the next generation of the medical profession.
There's one more question, Dr. Naveen, that's for you also. People are asking, given that a new variant of COVID-19, do we need booster shots in India?
So short answer is yes. And it may go in again a priority framework. Who needs it? The person who have comorbidity above 60 years of age, those who have received in early when we gave two doses very close to each other of Covishield, those who have not suffered those who have received inactivated vaccine like Covaxin, and if you have two doses of say Covishield spaced at say 84 days, and you have also suffered COVID, you are better placed. So it may need a prioritization, but the short answer, the large evidence now coming from different parts of the world. But we should not forget that still the first most priority is to give two doses to everyone. So definitely there will be prioritization. And somebody asked me just yesterday, it takes time in country like India. Government has to take into the consideration so many things, and we should not jump into the conclusion that, again, this becomes uncertainty and just push for it. Thank you.
Right. Sangram, there's a question about, do you see some states doing well in terms of adopting technology in India? We hear about Gujarat, we hear about Hyderabad, Andhra, Karnataka. What has been your experience, which states or states?
Yeah. So I think maybe you already given my answer as well. So 3-4 states which we see, of course, Maharashtra, Gujarat, Andhra Pradesh and Karnataka, Telangana. These are the states we are always at the forefront of adopting technology. If you go with the new areas, I think they are always ready to embrace and give it to their citizens. Some of the other states are following, like Delhi. We could see they are trying to adapt, maybe thanks to central government being based there. But yes, here also we see some divide as well. There are few states, even after pushing so much, they're not ready to really understand. But with schemes like Ayushman Bharat, with schemes like Digital India, with Skill India, we are seeing, I think, almost all states have realized the importance of the digital and technology. So hopefully, I think as we progress, we will see more adoption by the other states as well.
Okay, last question for Dr. Kranti, actually. It's about on women's health. They're saying that awareness remains a major challenge in rural areas. How to address it? We have a huge population which lives in rural area, massive population. How to address it? What really do we need more money to put more resources on ground? Do we need more skilled manpower on ground? What are the things we need to do to improve the awareness about basic healthcare for women essentially?
I would say that awareness is there. We mistake uneducated women to be stupid. They are not. They are actually much smarter than what we think they are. They invest in where they know they'll get their money worth. So I think awareness is there. What we need to do or we need to ensure is access. Given the social environment that we are in, being a patriarchal society, every decision is made by the men, and money is with them, phone is with them. So access is a major issue. So there is major unmet need. They want it, but they are not getting it. So I think we need to invest in that. We need to ensure that they have access to information, they have access to services, they have access to preventive services. So those are the things I think we need to invest in.
Right. And one more question, quick. Someone is asking about startups. What is the advice you think for a young startup who is trying to do something in health or diagnostics? What are the areas they should really focus on where the tech can make the difference?
This for me?
You go ahead, then Arun can also add the thought.
Okay, yeah, I'm sorry, Varun. I think one thing which I have seen is what happens is an engineer is sitting in the college or somewhere, and his mother is having hypertension or diabetes, is not taking tablets regularly. So he thinks of something and then they jump and they make a gadget. So market survey, which is done usually with other startups and other products, such things are not done. Perception of end users is usually not taken into account at the beginning. So whenever there is an idea, try to talk to someone that you think would be your end user. How do they perceive? For them, is this a big issue, and do they see this as a solution? Second thing, as I said, whenever you are validating, don't validate in 600 and go to the market. You would fail miserably. We are seeing on Amazon a lot of gadgets that are not working and then they fail miserably. So validate properly in all extremes and be prepared for a long haul. It's going to take more years than you would see in any other startup for healthcare.
Excellent, Dr. Kranti. Varun, you want to add?
Yeah, just adding on, to the great insight shared by Dr. Kranti. One suggestion is that do not follow the typical sequential process that you will follow in like a retail or an e-commerce or a fintech startup, where you have an idea, you make an MVP, apply for funding, go for product development and then scale. Health tech is a very different sort of a sector. Rather try to follow more of a loop structure, which is more of a holistic structure, wherein the team, right from day one, it starts building on strength that, which are the clinicians I want to engage, where will I try to get my validation done, which are my test beds, who are my principal investigator, what is the government regulation, that really dictates the working of the device, which are the entities which will actually help me procure, what type of evidence would I need. The problem is a lot of times, we follow sequential process that, the team is only concentrating on clinical validation, full time. Then once they are done, they understand, oh, this was something, which was very different from what the government requires it. Then they are focusing on the commercial validation. What really happens is the journey, which should have been ideally completed within 12 to 15 months, it takes them, a 3-year or a 4 period, due to which, the funding dries up. There is, a dip in the motivation. The VCs, they find that this is too dragged. So I think the idea is to, change the approach. So if you're doing a health tech startup, my suggestion is a great time. Just, reflect on the approach that you are following and, adapt yourself to and look at some of the successes that have happened. I think that is something that will help you understand the health sector and crack it.
Right. Sangram, you want to add a final thought?
No, I think I just wanted to share one data point, which is complementing to Varun and Dr. Kranti. Only 5% of the startups are successful if I have to put the overall startup ecosystem. And I think healthcare will be much lower than that. So we need to spend time, and I think let's have a realistic expectation. I start my startup and I can't expect that I'll be a unicorn in next 6 months, 1 year. I think gone are those days. I think that is where we spend a lot of time in planning, you'll be successful.
Okay, I've got one final round. I would request all of you to share one final recommendation very briefly, either for the Union Health Minister or the Health Minister of Gujarat, for how to improve healthcare and its delivery in public health in next 5 to 10 years. So I will start with Dr. Naveen Thakur. Very briefly, sir, what will be your key recommendation for the government, how to improve healthcare in India?
I may be biased, but I will say invest in the data and information system. As Dr. Varun said, there is a data, but we don't know. So invest in that, use data for action and make it available for everyone.
Dr. Kranti, what will you recommend as a key recommendation?
Yeah, I'll actually follow up on Dr. Naveen's this thing. And this is something which I've been trying to do is what data has done is it has made the approach top down. We need bottoms up approach. So train first level health leaders such as female health supervisors to use the data. You have given them tablets, they are collecting data, but they don't know how to use data at their level. So operation research sort of not exactly that, but that sort of skills to use data to improve their work.
Sangram, what will be your key recommendation?
My recommendation is something integrated platform where both public, private, and different strata of the healthcare overall ecosystem can be part of it. So sitting it here, like US and some of the other developed countries can have access. So one solution which will cover again data and information what Dr. Kranti and Dr. Naveen mentioned, integrated platform.
Varun, what will be your key recommendation? You're being part of the new national health system anyway.
Yeah, so I might be a bit more biased with that, but I would suggest, expand schemes like Ayushman Bharat to cover, more wider population. Also, to see how we can roll out some sort of a co-payment model for the people who are not covered. Second would be open up avenues for, more health tech startups to participate in strengthening the health system. And third will be, expand the type of reach that the Ayushman Bharat Digital Mission have to really, get that technological backbone that the healthcare of the country needs.
Thank you so much. I think it was really a pleasure. I wish there was more time and we could have really discussed a couple of issues here and subjects here. But I think we really had an insightful discussion. And thank you so much for joining us. It was really quite a learning to understand how you see it from a different prism actually, and very original thoughts. And this is really going to be quite helpful for us as we move forward for next year. We're going to club all these thoughts together in the shape of a booklet or so. And we are going to share that with different stakeholders, including WHO, UNICEF, the Government of India. So I'm pretty sure that we will all benefit from the insight of the thought leaders like you. Thank you again. Thank you so much. And over to you, Surbhi.
Thank you so much. I think what an insightful discussion and a wonderful, our participants also posted a lot of questions. In fact, but because of the paucity of time and online, we will not be able to take all the questions. But however, we always tell our participants, you have our email ID. We will post it again on the chat box. If you still have anything to say, if you have any questions still, please write to us and we will address it to all our speakers present today.
So we were also going to edit, post this video at the end of this session for the other people who are not able to join today.
Yeah. All right, so moving forward, I think before we start our next session, we will take, I think we need our participants in here to do a quick poll. We will start the poll. I would request my colleague Shivali to start the poll. This is a very short poll. All that you need to do is click on the right option that you think is right. Here we are, if you can see your screens, the poll is here. There are 6 questions and we will have approximately 2 to 3 minutes to finish that. All right, here we go.
Thank you, Surbhi. I will push off, Surbhi. Thank you so much. Thanks a lot.
Thank you.
Thank you so much.
Thank you. Thank you.
Thank you.
Thank you. Thank you for hosting it. Thank you.
Varun. Thank you. Right, participants, here we go. The first question is, according to you, what should be the top priority for healthcare in India? I think what an important question. The second one is, how would you rate India's handling the COVID-19 pandemic situation? The third one, looking forward for next year, which of these are considered critical or top priorities for your organization? The fourth poll question is, would you like Birlasoft to connect with you to discuss how they can help you with establishing spend controls in your organization? And the fifth one, would you be interested in a free demo? If yes, please mention later. Please mention that too. For your upcoming, or for our upcoming summits, which are the topics would you like us to cover? We've covered a lot of topics in the past, which you've done in different states, but if there's anything that you still feel that we have missed out, please do let us know. All our summit recordings are on the YouTube channel of Data Leads. We would request you to go through them and let us know if there is something that you want us to cover. With that, I think we are ending the poll here. And moving on to the next session today, which is the Flash Talk session. May I now invite Varadarajan Ananthakrishnan, who's the resident editor with Health Analytics Asia, to start the Flash Talk session and moderate it. Over to you, Raj.
Thank you, Surbhi. Good morning again. I'm Raj, resident editor of Health Analytics Asia. After an insightful plenary session, it is now time for Flash Talks, where some leading lights of the industry will share their thoughts about their respective areas of expertise. First up, we have Ankit Modi, founding member and senior product manager, Cure.ai. He will be sharing his views on how to use artificial intelligence to make healthcare more accessible and affordable. Over to you, Ankit.
Hello. Hi, everyone. Thank you for giving me the opportunity to produce what we are doing with AI in public health. So just let me know if you can see my screen. Right. Is it visible?
Yeah, it is.
Right. So I will give you a brief overview of what Cure does, and then we will take you through some case studies which will highlight how we have been impacting healthcare so that it becomes more accessible and more affordable, especially for low and middle income countries. Yeah. So first of all, what we do, we are a radiology AI company. So we take medical imaging data and we apply the artificial intelligence technology to identify signs of diseases in these images. So it's very similar to like how you upload a picture on Facebook and the algorithm is able to identify your friends and asks you to tag them, right? So we took the technology and thought like if Facebook can identify people from pictures, can we identify diseases from these medical pictures? And the answer that we found out is yes. So these are the couple of products that we have. So there is QXR, which is an automated read of chest X-rays. So it detects around 30 abnormalities automatically from chest X-rays. Then there is QCT Rung, which is a similar product on chest CT scans. We have QER, which is again automated interpretation of head CT scans, and then QXR Hatch, which is basically automated detection of fractures from X-rays of other body parts. So considering these products, I will jump to the case studies now. We are deployed in more than 50 countries with more than 428 sites, including hospitals and screening centers using our technology. We have been impacting 3.5 million lives every year with this technology. So the point is that the healthcare is becoming accessible because of AI, because it's giving access to radiology in countries and regions where radiology is very hard to afford. And the affordability part comes in more developed regions where the cost of healthcare is rising and technologies like AI can bring it down. So let's go through some of the case studies where we have created major impact. The first one is it's based out of Philippines. So this was the very first project that we started 3 years ago. And this was to find the missing million for tuberculosis patients, right? So this was a van, if you can see here, which used to go to villages from the capital city of Manila in Philippines and used to collect chest X-rays of people for a week. And after a week, it used to come to the city. Then doctors used to read it for 2 weeks. And after 2 weeks, the van used to again go back to these villages, and patients who were identified as probable of TBs would get access to the medicines. And so the whole process was actually completed in 4 to 5 weeks, right from when the chest X-ray was collected in the van versus when the medicines was given to them. And these were people who were daily wage workers, right? So it was very hard to get hold of them the second time after 5 weeks, because they would again lose one more day of wage and they didn't want to come back. So what we did was we realized that the X-ray van is actually going to the villages. Why not put our AI technology in the same van, and right then and there, just when the X-ray is taken, within 2 minutes, an interpretation would come and the patient will know whether he is probable of TB or not. And then you can do a microbiological test and give the medicine then and there. So the whole pipeline of 5 days was reduced to less than 2 minutes. There are 4 mobile vans that are currently running. And the impact of this has been huge. Like we have been able to identify 25% more cases in TB across 100 plus municipalities. 50,000 plus people have been screened through this technology. And we have saved around $40 for the healthcare industry on a per case basis. We have been working with the Indian government as well on a similar line. So this is a project that we are doing in Mumbai, where a similar X-ray van has been identified, and then the X-ray machine is fitted on top of it. So if you look at the lower picture over here, again, there's a computer which is running this AI algorithm on top of it and identifying patients who are more susceptible to these diseases. So we are estimating 100,000 people would be going through this technology. We are deployed across 13 peripheral hospitals in Mumbai, and we have identified 46% more people who should have been taken a sputum test. So the impact here is that once you identify TB early, right, it not only saves the patient lives and improves his own life, it also prevents TB from spreading to more people. Like if that person was allowed to go back into the community for 5 more weeks without realizing he has TB, he was spreading the disease to more people. So now, like, if you reduce that timeline from 5 weeks to 2 days, 2 minutes, he is able to prevent that disease from spreading further. Similarly, we have worked we have done a very interesting project with BMC during the first COVID wave. So if you remember last year, during the first 2-3 months of the pandemic, the cost of RT-PCR tests was very high, and it was not possible to go into regions like Dharavi and do RT-PCR tests for everyone. So what we did was we realized that the chest X-ray costs around 300 to 400 rupees per X-ray, and then the reading cost is high. But the problem with reading is that reports come after 2 or 3 days. So what we did was we again took a van. There was an X-ray machine there, and the AI technology was fitted into it, and 30,000 people were screened. 20% people were alerted for institutional quarantine due to the technology that QXR had inside it. So that is where we impacted TB and COVID-19. Now I would take you to the impact of other product, so which is the QER, interpretation of head CT scan. So this is a village in Himalayas in Assam. So this is called Baptist Christian Hospital, a 130-bed secondary hospital in Assam. And hypertension is sort of a big risk factor in that region. The problem there is that there is a CT machine, but there is nobody to read those CT scans. And stroke is a disease where if you don't read the patient within 24 hours, it's very hard to save them. So then we again went back there and we realized that the AI needs to intervene over here because the radiology access is just not present. So if you look at this person over here, right? So he's a healthcare worker over there, and the CT scan is coming to his phone along with the AI interpretation, and he's knowing that the patient has been flagged. He has been flagged with what kind of hemorrhage he has, what kind of volume that hemorrhage has, and what is the appropriate treatment pathway from there on. So this robustness and the speed that they have been able to tackle this disease has been impacting a lot of lives. So basically 50% stroke cases have been impacted with QER over there. Lastly, I want to give an example of Latin America. So there, lung cancer is a big problem. And again, we have QXR and QCT both to screen patients for lung cancer. So there, the problem is that they don't even have digital X-ray machines. No? So they have the machines where the X-ray is printed on films. So we tweaked our technology where a doctor can just take the X-ray film, place it on a white screen, take a photo of it, and then upload it. So this is the mobile app that we have. You take a photo, you crop the photo appropriately, upload it, and then the patient will be flagged if he or she is susceptible of lung cancer. So then you can quickly intervene and then do a CT scan, biopsy test, whatever. So early screening saves a lot of lives because most of the patients in lung cancer are identified in later stages. So 70% cases are identified at the stage 4 of cancer, whereas only 4 to 5% are identified at stage 1. So our technology is intervening to reduce that 70% on a lower side and increase this 5% on the higher side so that we can save costs on healthcare before the cancer reaches the higher stages. So these are the major disease areas that we have been operating in with the whole product suite that we have, including QXR, QER, and QTrack. So just talking about a couple of innovative partnerships that have come up recently. So this is a project that we are doing with Toyota, Fujifilms, and Molbio. So there, this is the car that Toyota has built in. Fujifilm has put their X-ray machine inside it. We have put in our AI algorithm inside it, and Molbio has put in the TrueNAT test inside it. So this one car is sufficient to go anywhere, any remote region, get the X-ray done, take the analysis, and if the patient is susceptible, then you can do a Molbio test, and if the patient is positive, then just give them medicine then and there. So they don't need to follow up, right? They don't need to come back again to the hospital. You don't have that problem of not getting access to those patients later. The second case is, again, we have worked with Fujifilms here. So this is a device called Zaire. This is a handheld X-ray device, and this can be carried anywhere. So it's not a huge device where you will need a car or a truck to carry it. This can be held on hand. You can just take a snapshot of the patient and you will get a chest X-ray. Now, the interesting part over here is that this is a very, very small device, and we have been able to use our technology to fit our artificial intelligence algorithm inside this machine. So now not only this is taking pictures of X-rays, capturing X-rays, it is also capturing the entire interpretation of the AI algorithms, and people are, so now you don't even need the car or the bus to go to remote patient. You can just take this machine in your hand, QXR will be inside it, and it will help you identify patients who should be intervened immediately. So those were some of the case studies that I wanted to talk about. I hope, I've been able to share some useful information and give a sense of where healthcare might go with AI intervening in between. Thank you.
Thank you, Ankit. It would indeed be a fantastic day when AI can make healthcare affordable and accessible to all. Our, ne- our next speakers are Rajesh Kupuswamy, Health Sciences Advisor, SAP India Private Limited, and Ramesh Menon, SAP Practice Lead APAC and Europe from BirlaSoft. Rajesh and Ramesh will jointly share their thoughts on the power of digital technology in healthcare. Over to you, gentlemen.
Thank you. So just a quick introduction to how we see technology making an impact in the pharma industry. So let me just start with my screen. Okay, so I assume my screen is visible. The reality today is that we are faced with drug shortages, and the reasons can be numerous, but the fundamental point that one cannot miss is that the quality of products that are coming into the market, doesn't matter which part of the world you're talking about, it's a problem. And this is being caused due to multiple reasons why quality is getting impacted, but the ultimate point, it is a problem. And that problem becomes bigger when it goes to the extent of having to remove certain products from the market, and that causes shortages. And once you have shortages, it's very, very difficult to come back, both for the company which was supplying to the market as well as the patients who are impacted due to that. And quality, as I said, is due to multiple reasons. There are manufacturing problems, testing problems, and then there are problems in the supply chain area as well. And these are areas which we can truly avoid these kind of problems and ensure that the shortages are not as significant as it used to be. But see the impact of shortages. We are talking about the beginning of 2020. 56% of hospitals, they had to change the patient care or delay the therapy because of shortages. More than 50% of the drug shortages faced in 2019 was faced within the first 4 months of 2020. And if you really think about the pandemic rate, it had really not caused a global impact till about the beginning of second quarter of 2020. And this has only gotten worse with all the issues around supply and other geopolitical tensions flaring across the world in different pockets. So this has only got worse. And it is also something worthwhile to note that this is not unique to just one kind of problem. It is for chronic, it is for lifestyle diseases. It's practically for all kinds of diseases. This is an impact. So about a couple of years ago, the US government formed a bipartisan task force to come up with seeking recommendations as to what can be done. And the short end of the story is, first of all, one needed to understand why there were shortages and really understand what is the impact of the harm caused by those shortages. And a clear point that came out is that there must be some incentive to reward quality rather than just punishment to ensure that only those who get caught in any inspections, they are being penalized, but it's more about quality is being rewarded on the larger front across the globe. It was also a recommendation from the FDA through other initiatives that data needs to be shared and needs to be made available to the relevant stakeholders so that better decisions can be made, and better risk management guidelines should also be prevalent globally. So if all of this were to be summarized as mandate for the industry, there were three things that the industry really needed to do. So take care of serviceability, ensure they were agile, and maintain their reputation, especially as it comes to quality of the products right from the time it is manufactured. During the whole supply chain, there is no counterfeits entering into the supply chain till up until the point the patient gets the drug product. Now, if one were to think about how technology can influence and help the industry in this cause, you really think of three things: how you can make a connected environment, how you can have a continuous environment, and we already heard from the earlier speaker about the power of computing, what AI can do. AI is just one, but there are many such technologies which have now significantly provided us with advanced computing power. And if I were to take one example of an industry response such as agility and how technology can influence, it can ensure that it can provide a connected network across the stakeholders, providing real-time visibility so that any issue on one side of the supply chain can effectively be balanced through some adjustments in other areas, ultimately to ensure that the shortages are not there, quality is not impacted. So a very brief point of view for how we advise our clients on what needs to be done when it comes to designing their business models and strategies going forward. Have clarity on business priorities, which markets you're going after, what are the products or services you want to offer there, and what extent is fungibility required so that you are able to operate in uncertain times, such as how we see the whole world not affected just when the pandemic started, but continues to impact even today, and how you can offer yourself as a trusted partner in the ecosystem. So very briefly, what I'll do is I'll play a short video what SAP...
Fake medicines have become a multi-billion-dollar trade with a higher profit margin than heroin trafficking. Worldwide sales of counterfeit drugs could top $75 billion this year, a 90% rise in 5 years. Today, Asia accounts for the biggest share of the trade, with patients' health put at risk. Now big healthcare corporations like Zuellig Pharma are fighting back.
According to the World Health Organization, up to 1 million people die every year because they've inadvertently taken fake medicines.
Zuellig Pharma, one of the largest healthcare groups in Asia, partnered with SAP to develop a mobile application-based solution which uses blockchain technology to detect fake products.
We've developed a product that we call Easy Tracker, which is built entirely on SAP technology. We use SAP blockchain as a service to empower the end patient and healthcare practitioners to be able to tell the material provenance of a drug that's passed through the Zuellig supply chain.
A consumer can use the app to scan the barcode on a medicine she received. In a split second, the Easy Tracker tells her if the medicine is genuine and where it was manufactured, giving the patient power, insight, and security.
Well, it's really great to be able to check the authenticity of a medicine on my own, and it's really easy to use. It just takes 2 clicks to get to the information that I need about the medicine.
The Zuellig Pharma distribution network covers some 350,000 clinics and pharmacies in even the most remote areas of Asia.
So basically the bottom line is there is technology available today. It's up to us how to avail of that and take the best advantage to serve the community that we are all part of. Over to you, Ramesh.
Hey, thank you, Rajesh. Hello, everyone, and thanks to Data Leads for this opportunity to express my thoughts and my lots of contribution for this industry sector. To start with, I would say this industry sector is going through unprecedented pressure due to COVID-19. But before too, it was not easy for this industry. I mean, as Rajesh has discussed about counterfeits, which has introduced a new mandate for having a track and trace in the entire supply chain. And for this industry, global regulations and compliance were never easy, guys. I mean, they were made easy. It is getting more stringent every year on year. Other trends which we have observed, apart from these two of track and trace and regulation and compliance, is the no, I mean, this industry has to catch up with new approaches like connected patients, connected devices, and growing service centricity. So let me discuss one such interesting success story from for Soft in assisting one of the pharma giant. I mean, it is interesting because it happened in the early COVID times. So we helped this firm to accelerate the drug discovery and development. I know many will be wondering how IT service provider can help in the core pharma process. To break suspense, it's all about enabling a quick decision with the help of automation and management. It's all about data, as you know, as previous panelists have discussed in detail about it. So for this industry, for this client, the main challenge is arise due to first in human trials, FIH. Okay, and it introduced a lot of new variables. Okay, like no, like in drug in entire cycle of drug evaluation process. There was a lot of delay induced due to alignment issue, lack of collaborations, and there were other factors. Like no, there were non-standardized decision-making process, lengthy cycle. Basically, as other panelists mentioned, you need a lot of visibility of prior trials, preclinical data, and no, they had a very difficult time or challenge in getting those information handy with them. So our approach was quite simple. We went with a strategy to go with the computer-aided standardization. We introduced a clinical data collection process and standardized data intake via smart forms. So this data was then mined and collated and supplied to multiple subsections of pharma regions. And for them, and we built a very custom platform with a very intuitive visualization, which helped them to interpret data easily and make decisions faster for FIH. There's one more which I would like to share. It's very interesting because it's my favorite because I was directly involved with this client. This is one of the leading biotherapeutic company with a very strong focus on advancing critical care. What we did, we helped them in improving the sales efficiency. So, again, people wondering why sales efficiency is coming in this sector. If sales is efficient, entire supply chain will be efficient. So, the end result, the end consumer will get benefit faster. So, we help them to improve the sales efficiency. We design and build their hybrid app with SAP integration. It was a quite quick value enabler for the client's field sales team. They used to get the real-time information, which helped them to make them a quick decision. And in turn, they are able to provide a commitment to their client, which improved their overall sales operations. Yep. So if I were to summarize, I will say that it's sort of business mandate for this industry, for healthcare companies to adopt, modernize their underlying business system. Not only to provide a good service to a client, but in turn to be competitive in this industry. So it is a mandate for them to adopt this modernization. So when we say modernization, it has to touch all the four pillars: cloud, mobility, IoT, and of course the analytics piece of it. Being SAP, SAP partner, we always say that SAP Intelligent Enterprise option, it help every client to adopt these levers, okay, and it helps them to make the organization agile, resilient, profitable, and of course sustainable. Yep. Thank you.
Thank you. Digital technology in healthcare is indeed the buzzword today, given the pandemic situation in the world. Thank you very much, gentlemen, for sharing your thoughts. Our final speaker for the day is Nina Claire, Wellbeing Crusader and founder, Pursuit of Balance. Nina has served as an editorial lead in wellbeing space with reputed media organizations. She's a content curator, speaker, and even producer in the space. Nina will share her thoughts on importance of mental hygiene. Over to you, Nina.
Thank you so much. I'm so happy to be here. And once again, enough people have said good morning, but good morning once again. And as mentioned, my name is Nina Claire. I'm a well-being crusader and a mental health advocate. And I do want to share that my passion sort of is fueled from the fact that I studied psychology, but I've also had anxiety from the age of 19. So that's a couple of decades now. And I think it's very important to talk about it. And I'm going to read my thoughts because I have a few minutes and I don't want to miss out a thing. So whenever I talk about mental health as a talk or as a panel, I'm always taken back to the time when I was heading the wellbeing platform at a media house. And I kid you not, the entire digital team hated me because they would keep on telling me, Nina, 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 ye jo aap mental health ke article bhejte ho, iska koi fayda nahi hai. Because I would write the articles, I would have guest authors write the articles, and I'd bombard them constantly. And they'd say, Nina ji, ye jo bimari hai na, ye sirf ameer logo ki bimari hai. And I'm happy to say today they're very good friends and they understand the conversation. But the idea that I feel as a mental health advocate today is that it took a pandemic for us to start even talking about this topic. So it's really ironic, I feel, that it took a pandemic for us to sort of wake up and smell the coffee. It's a beginning, I say, it's a beginning. And I'm happy that there's a beginning, but we have a very, very, very long way to go. And while I was researching for what to talk about, I came across one of these favorite quotes that I have from the World Health Organization, which is the World Health Organization itself makes it very, very clear that mental health is an integral part of health. There is no health without mental health, but it took us a lifetime to get here. And the COVID-19 pandemic has put our psychological well-being to the test, and there's only one way really to preserve it. And that is by looking after our mental hygiene. Pretty much like you take care of your physical hygiene, you have to take care of your mental hygiene. And to achieve that, we need to avoid negative behavior, achieve emotional equilibrium, and improve our quality of life. I mean, these are really fluffy words. It's no easy feat. It's a regular battle. It's something you have to do daily, day in, day out. And hopefully from moment to moment, once you start practicing it daily, it becomes a part of your life and a way of being for you, essentially. I don't think I need to stress enough or more on how the pandemic has caused. And a lot of people say that there's a new pandemic, the mental health pandemic. There is no new pandemic. There was always a pandemic of mental health. People are now beginning to talk about it. So we know that millions of people all over the world are showing signs of psychological stress due to the fight against the pandemic. So what already existed has become exponential at this point. So it's really important that we highlight this, underscore it, put it in bold, and lodge it in our minds. And when we talk to people, we highlight this fact that it was there always. And now we need to acknowledge the fact that there's no elephant in the room. It's there, always has been there, and it has to be given its due place and importance. Hence, it is pivotal to talk about it now. According to a UN report that I was reading, the effects of the pandemic on mental health today frequently cause panic, anxiety, and depression. So again, exponential, right? And I think everybody